Dr. Kakaraka, how to prevent heart disease. Heart disease. Our aim at Dr. Kakaraka is to put you in charge of your health, to arm you with the tools and information for wellness and longevity. In this video I will be sharing some health hints. Heart, or cardiovascular, disease is responsible for nearly half of all deaths in the United States each year, killing nearly 1 million people each year, and afflicting over 60 million others. Although heart disease is more commonly thought of as a condition that primarily affects men, in actuality it strikes slightly more women each year than it does men, over 52% women compared to just under 48% men. Despite this grim toll, heart disease is one of the most easily preventable degenerative health conditions, although conventional medicine is largely a failure in this area. The reason for this failure on the part of conventional medicine is twofold. 1. An unhealthy emphasis on factors, such as cholesterol levels, which are far less important to overall heart health compared to far more serious causes. And 2. An unwillingness on the part of cardiologists and other conventional physicians and researchers to admit this. As a result, nearly $60 billion is spent in the United States each year to treat heart disease using conventional methods that are often ineffective and fraught with many severe side effects. By contrast, holistic physicians and other practitioners of natural healing methods have a much higher overall success rate when it comes to treating and preventing heart disease. The methods they employ are not only more effective, they are also much safer and usually far less expensive. Types of heart disease. Cardiac arrest. Cardiac arrest is a condition in which the heart stops beating. Unless treated immediately, it can lead to death. Congestive heart disease. Cardiomyopathy. This condition is characterized by congestion of blood within, and weakness of, the heart muscle. It is often accompanied by shortness of breath without physical exertion. Left untreated, it can result in complete failure of the heart muscle, congestive heart failure. Coronary heart disease. Coronary heart disease refers to atherosclerosis of the arteries that supply blood and oxygen to the heart's muscles. It is one of the most common forms of heart disease in the U.S., and can frequently result in angina and heart attack. High blood pressure, hypertension. High blood pressure is one of the most common health conditions in the United States. People affected by this condition have higher than normal blood pressure levels as their hearts pump blood throughout all the body's arteries. This greater than normal force can damage the walls of the arteries, which in turn can result in dangerous deposits of harmful LDL, cholesterol and various toxic substances sticking to them. If this process is left unchecked, the end result can be heart attack, stroke, and other cardiovascular conditions. Stroke. Stroke is the third leading cause of death. Stroke occurs due to diminished blood flow to the brain, blood clots, and/or internal hemorrhaging and ruptured blood vessels, all of which can lead to a lack of oxygen to the brain, causing areas of the brain to wither and die. To a lesser extent, stroke can also be due to birth defects, genetic disorders, and rare forms of blood disease. Infections. Chronic infection is another often ignored cause of heart disease. The invasion of bacterial and viral infections in the body can trigger a corresponding buildup of vulnerable plaque as the body tries to halt the spread of infection. According to researchers, the primary infectious agents associated with heart disease are chlamydia, especially chlamydia pneumoniae, which 95% of all people come in contact with at some point in their lives, cytomegalovirus, CMV, the herpes family of viruses, and Helicobacter pylori, which is also associated with most cases of stomach ulcer. The link between infection and heart disease has been established by various scientific reports, including one published in the Journal of the American Medical Association, JAMA, which indicated that up to 55% of potential heart attacks are prevented when patients receive antibiotic treatment. Oxidized cholesterol. It's not the amount of cholesterol you have, good or bad, that determines your risk of heart disease, but whether or not cholesterol becomes oxidized. Otherwise, cholesterol plays a valuable role in your overall health, not only maintaining the health of your cells, but also helping to maintain proper immune function, kidney function, and the manufacture and regulation of your body's supply of natural sex and steroidal hormones. Genetic predisposition. Hereditary factors can genetically predispose a person to develop heart disease, although such a predisposition does not make heart disease a certainty. In fact, knowing if you have a genetic predisposition for heart disease, or any other illness, can actually improve your ability to prevent it by taking the proper preventive measures. There are many lifestyle changes that can improve heart health and prevent or manage heart disease. Here are some examples. Eat a heart-healthy diet. Focus on a diet rich in fruits, vegetables, whole grains, lean protein, and healthy fats. Avoid foods high in saturated and trans fats, sodium, and added sugars. Exercise regularly. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. This can include activities such as walking, jogging, cycling, swimming, or strength training. Manage stress. Chronic stress can contribute to heart disease. Try stress management techniques such as deep breathing, meditation, yoga, or therapy. Quit smoking. Smoking is a major risk factor for heart disease. Quitting smoking can significantly reduce your risk of heart disease and other health problems. Limit alcohol consumption. Excessive alcohol consumption can increase blood pressure and contribute to heart disease. If you choose to drink, limit your consumption to no more than 1 drink per day for women and 2 drinks per day for men. At Dr. Kakaraka, we are passionate about your health and wellness. Contact us anytime for a permanent solution to any health issues bothering you. Get our H-Band health tracker that enables us to track, treat and inspire you to optimum health through well-versed knowledge, experience and artificial intelligence. Join us on all our social media handles for constant update. Like, subscribe and share. Thanks for watching.